Garen Cohen with American Warrior Radio Show. Thank you for joining us. Like and subscribe, please. And spread this information around because that's how we help our brothers and sisters in arms and their family members. Keep in mind, when we're talking about mental health, it doesn't just affect the service member, does it? Dr. Scott Fairchild, my wonderful guest again.
I tell you, it affects the entire family.
See?
It affects work environments. It affects the society. It affects the community. So we have an impact that flows throughout
exactly. And we have covered an amazing new technology in previous episodes. Check it out. Go back in history and find it. Our producer, John Lopez with Real Kingdom Media, is the awesome dude that puts all this stuff together. So find it and watch it and share it. You got another technology.
There's another new one shared by the good Dr. O'Leary, and it's amazing. It's amazing. Now, I learned a little bit about this again. You know, this stuff trickles through literature over time. Learned a little bit about this a couple of years ago, and folks may be aware of it, particularly if you've been to a psychiatry clinic, because psychiatrists came up with something they call transmagnetic stimulation. Whoa, that's a mouthful.
Yeah.
So the transmagnetic stimulation is taking a magnet and stimulating the brain, and allowing the brain to kind of reorganize and get straightened out as a result of that.
Are we talking like a hat? Or are we talking probes? What are we talking?
It's just like a little flat plate, a little flat metal plate, and they put it close to your head. They turn the magnet on, and your brain just responds in a positive way. Now, the interesting thing is that the psychiatrists just kind of bombard your brain with it, just shoot it at it, shotgun. And it's been fairly effective. It's about 30% effective.
Remember to scramble my brain or sort things
Remember in the old days, they had electroconvulsive shock therapy. Fortunately or hopefully, we don't use that much anymore. But we do have...
But they do in severe cases, don't they?
They do in severe cases.
And this people are intractably diseased.
Exactly. One of my veterans who I've just talked to recently went through 36 treatments of electroconvulsive shock therapy, was in the hospital for months, and finally came out, and he's okay. So that's a good sign.
Okay, this is not that, though.
But this is not that. It is not that at all. Transmagnetic stimulation, you don't have any feeling with it. You don't notice it. It's just the magnets adjust your brain. And so the psychiatrists have been doing this for maybe 3, 4, 5 years. In fact, next week, one of the representatives of the TMS company is coming over to talk to us about it.
Nice.
But they have about a 30% effectiveness rate. And they're largely very effective with people who are profoundly depressed. So the researchers...
Can depression coexist with PTSD?
Oh, absolutely. PTSD includes depression, anxiety, and being stuck on something that you can't let go. We call it the PTSD diamond.
Which you've spoken about in the past on American Warrior Radio.
Exactly. So looking at this new technique, the researchers and a very, very fantastic individual, I'll just name him by his first name, Joseph, he went ahead, he's a multimillionaire. He just wants to help veterans and he wants to help people who've experienced trauma. So he started doing this research, worked with the researchers, and he started setting up clinics across the country. He currently has 23 ETMS clinics across the country.
What does ETMS stand for again?
An ETMS, if we take transmagnetic stimulation,
TMS.
Now what we're going to do is we're going to do an EEG so that we can focus. We can project it right into the areas that need to be treated. And so how do you do that? Well, you have to do the E part first. You have to do the QEEG, which we used to do at our office. You wear that little bonnet, and there's no pain involved in it at all. It just measures. It measures your EEG waves, like a heart measures your EKG wave.
Okay.
It measures the waves of the brain, delta, theta, alpha, beta. Delta, your sleep waves. Theta, your creative waves.
You see how much you learn watching American Warrior Radio?
Alpha waves are the relaxed and getting the job done waves.
Okay.
And beta waves. We all need a little beta to get us going and off the couch. But if you have too much beta, it gets you anxious. And almost all of the people that I know and treat for PTSD have way too much beta. That's why the alpha stimulating alpha, calms down the beta and allows people to function better. So we do
So the QEEG.
The QEEG is in
defines
session 0.
For you, a serious clinician. This is not for some slipshod dude or gal. You have to know what you're doing.
You really do. You have to be well trained. And so the QEEG is done in what we call session 0, the first session. They do a QEEG. They send it off. We don't even score it locally. It's sent off to a team in California, a team of experts who review your entire QEEG and determine what areas are not communicating well in your brain. Then they make a recommendation to design the transmagnetic stimulation specifically for those areas.
Wow.
That bumps the success rate all the way up to 85, 90% from that initial 30%. It's remarkable. It treats anxiety, it treats depression, it treats symptoms related to PTSD, and most recently, it's been used in drug rehabilitation with PCP, with fentanyl, and they're getting high success rates. Normally with those things, we're running 10 to 15% success rates. It's very, very difficult. Now, 70, 75% success rates with substance abuse. And that's why these states are jumping on board and saying, hey, we want this in our state. And this very generous individual has been able to get grants from Ohio, from Minnesota, from Iowa, from various states. And he has 5 or 6 of these facilities in Florida.
Nice.
We had a great meeting the other day, the ETMS group, and there were 5 cities in Florida vying for that next site.
Yeah.
And fortunately, victory.
Yeah.
We're bringing it to Melbourne. It's going to be located beachside at Crystal Terman's clinic, and she already does brain work, and she has QEEG techs who are trained, and she's got the 2 rooms available. I just got an email from her, a text from her yesterday, and she's about to sign the contract with them. We can expect to be up and running in late May.
Wow, this is important.
It's beautiful, and we're taking a waiting list. We have 26, 27 people on the waiting list. Call Baytree Behavioral Health. Get your name on the waiting list. So what is this ETMS? What is this stuff? Let's take a look. I took a trip over to Orlando to see one of my airborne buddies who's a representative for them. And he showed a little demonstration of it for me. He showed the demonstration about how they put the paddles on your head. And for 5 seconds, tick, 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 the paddles do their thing. And then it's a 20-second interval of rest. And then another 5 seconds, they do 36 cycles. So we know exactly that your length of treatment is going to be 14 and a half minutes. They schedule for a half an hour, get you in and get you out. Now, one of your favorite words, Garen, and I know it. Your favorite word is free.
Free.
Free. Free. These treatments for civilians would be $20,000. You go for a half an hour treatment for 20 days. 20 days. Consecutively. Your only response is to be there for a half an hour, can change the time of the day for 20 days and get the treatment. They do a QEEG at session 0 and one at session 10.
A lot of money.
Insurance
isn't going to cover it.
Not going to cover it. $20,000. And because of the generosity of this company, they have coordinated with the states. They have a $10 million grant from the state of Florida, which makes it free for veterans, makes it free for police officers, makes it free for firefighters and first responders.
Wow.
So if you fall into that category, you can get this $20,000 treatment for free. And between this and the tax stim, which we talked about previously, Dr. O'Leary says to me, and most importantly, his wife says to me, he's not flailing in bed anymore. He has not had a nightmare in 5 years. And he has pointed out that in the last year, he sent the warriors forward. He said, of all of the operators that he sent forward in the last year, 0% of them have come back with PTSD as a result of these interventions, which is remarkable. It's just amazing.
And I just want to say, because we've discussed this subject in previous episodes regarding VA maybe proposing to reduce somebody's evaluation for a mental health disorder. Don't be concerned with that. Seek your health, because I'm telling you, if a combat special operator went out there and encountered some god-awful stuff, as they often do, and was able to come back and get that out of their system, they'd much prefer that than to have a VA disability rating.
Oh, yeah. And, maybe that's why in the old days they called it mental hygiene.
Yeah.
You said scrub. Yeah. To be able to clean that stuff away, to now have good family relationships with your wife, with your children, with your neighbors, with your friends is unbelievable. And, these things are done outside of the VA system. So there's no connection in terms of the reporting, except what you report to your provider.
Exactly. And if you get a tax stim or some other device from the VA, yes, I'm sure they're going to be monitoring because they want to know if it's effective.
Sure.
Doesn't necessarily play into kind of a claim review. And we can talk about that more at a later time, but I just want all of you to understand this is groundbreaking technology that Dr. Fairchild is revealing. And you just heard it's free, this ETMS, but you have to go through the process.
Exactly. And the beautiful part
And
of
you
it
have to
is,
be a candidate. It's not
You do.
going to be for everybody.
yeah, absolutely. And the beautiful part of it is too, they follow up. They've got some surveys and they follow up. So they have the data. The president of the company told me at lunch that it took them almost a year and a half to get into Tallahassee to present the information. But when they got in there in 3 hours, presented all that data, Tallahassee and Florida wanted this for their state
Oh,
to be in
my.
front of the others, to take care of the people who've experienced trauma. Again, the veterans, the police officers, the firefighters, and the first responders.
Sure.
Absolutely.
It sounds great. And again, they go to Baytree Behavioral Health to learn more about this.
Exactly. And get on the list.
Get on the list.
It's filling up fast.
Our producer is going to have information here that you can click on and go to. Like and subscribe to American Warrior Radio, because this is the kind of information that you need, and you need to share with others that may be affected in this way. Until next time, don't forget, thank a vet.